A patient who has been suffering from weight loss decided to open up to his medical doctor, and on examination the doctor realized that he was suffering from tuberculosis. He called this a zoonotic disease. And what could this be if not diseases that are transmittable from animal to man? No doubt this is a serious condition, and I should let you know that in the year 2018, 1,600 cases of this were reported in Ondo State. This is a severe situation, and this is why the society needs to buckle up in order to confront this challenge. Yomi Ogunye is my name. You are welcome to Health Matters, your TV health program, and my guest today is a veterinary doctor. She is Dr. Nonye Ukweni. And sister, you are welcome to the show.
Thank you very much.
I just told your audience you are a veterinary doctor, and we will be talking about tuberculosis. The title or the caption we have created for this is Public Health Significance of Tuberculosis, Issues, Action, and Resolution. Once again, you are welcome.
Thank you very much.
So first and foremost, I would want you to tell us, elaborately, what is tuberculosis?
Okay. When people hear tuberculosis, when you ask a layman, an ordinary person, what is tuberculosis, they get to start telling you cough. But tuberculosis goes beyond cough. Tuberculosis is a chronic disease which is caused by a microbacterium called Mycobacterium tuberculosis. But what many people don't know is, even though it's caused by a microbacterium called Mycobacterium tuberculosis, which can be gotten from humans, it could also be caused by a bacteria called Mycobacterium bovis, which is zoonotic in the sense that it could be gotten from animals when you're coming in contact with animals. So simply put, tuberculosis is a chronic respiratory disease, although it could be found in other parts of the body. But the main lesions associated with tuberculosis is the fact that it's a respiratory disease which is chronic and slow to show.
Thank you very much. It is a chronic respiratory disease. That's what you have just said. Now, the patient who has gone to see this doctor has been experiencing weight loss. Something must have led to that.
Yeah.
So if I may ask you, what are the causes and or the risk factors involved in tuberculosis?
The risk factors associated with tuberculosis are as variable as they are vague, like they are plenty. Overpopulation. Nigeria is overpopulated. That's why we are ranked one of the first countries to be associated with tuberculosis. We have a lot of tuberculosis in the community. Living with animals, because you see all these cattle, they have tuberculosis mostly. There is also the fact of immunosuppression. For example, HIV patients have the highest statistics of having tuberculosis. So when you have a disease that is causing your immunity to be suppressed, you stand a chance of being infected with tuberculosis. As I already said, tuberculosis is a slow to show disease. That means it could be in someone's system for a while and you won't get to know that, the person has tuberculosis, till maybe something like another disease comes and knocks the person's immunity down, and then you realize that the person has come down with tuberculosis. Other risk factors include, like causes, could include like your habits, like people that smoke. You see, you're reducing your ability to resist some things, like you're reducing your body's defense mechanism. Now, that reduce of defense mechanism is still associated with tuberculosis, like in the sense that you can get it. Now, tuberculosis is spread through aerosols, so that's to say that you could easily get it when you're in a compacted place with people who have tuberculosis. Like, I'm talking, you're listening, aerosols are being released, and then you realize that someone can get tuberculosis through that. You can get it through ingestion of food, like when the meat that goes into the market is not checked, you realize that someone can easily ingest food substances that have tuberculin nodules in them.
Thank you. You said aerosols.
Yes, sir.
What exactly do you mean by that?
Okay, aerosols are droplets of, let me say, saliva, which are released into the air. They are like dust. It can be dust, it could be from when we're talking, saliva is being released. So aerosols is just anything contained in air that contains harmful substances.
Thank you very much. In the process of answering the earlier question, you talked about the symptoms, and I did mention that the patient we have in focus here was experiencing weight loss.
Yes.
And at the same time, he was having a sweaty night. He was always sweating at night. Apart from these two, what other symptoms are associated with tuberculosis?
Okay. The most common symptom associated with tuberculosis is respiratory distress, that is coughing. That's why when you ask a baby, have you heard of tuberculosis, they'll tell you, yes, coughing. But there are a lot of things associated with tuberculosis, because what tuberculosis does is that, what the bacteria does is it enters your body, it enters the person's body, forms nodules. So these nodules, depending on where they are located, different signs can be seen. For example, you could have paralysis associated with tuberculosis. You could have liver failure symptoms associated with tuberculosis. You could also have kidney impairment issues, sterility issues, neurological issues associated with tuberculosis. But the most common lesions are fever, coughing, which has lasted longer than 3 weeks after being treated. You also have sweating in the night. Weight loss is very pathognomonic, because the person's immune system is constantly trying to fight these bacteria, so it results in weight loss. Now they could also be, the person can't eat, the person is depressed, the person is just not comfortable, so it comes with different signs.
Okay, thank you very much.
You're welcome.
We talked about tuberculosis being a zoonotic disease, which means it's transmittable from animal to man.
Yeah.
And you talked about the animal the other time. So if I may ask you, what animals are involved here? What animals could, transmit this disease to man?
The most common animal implicated in zoonotic tuberculosis is the cattle, because you see there are a lot of people who basically live with these cattle, and most of the times the most common thing is someone buys a cow and just slaughters it for maybe a function. No vet is looking at the animal, and they think everything is normal because they don't know what's normal and what's abnormal. So for now, I would say the most incriminated animal is the cattle, which if you check the statistics of the amount of beef we consume, it's really alarming. So
the cattle.
Yes.
Okay.
Which is the cow.
Okay. I just want to ask you, apart from the cattle, is there any other animal? Can
Yes.
you mention one?
Yes. Wild ruminants. It's still postulated that pigs and birds transmit tuberculosis, but it's not yet been totally confirmed.
Okay. So we look or consider, we put our focus on the cattle.
Yes, sir.
Thank you very much. Now, what is the prevalence of this?
Prevalence.
What are the statistics? I just told you about the situation in Ondo State. I would want your comment on this. Some 1,600 people here. Is that not too high?
That's really high.
Okay.
And it's really high considering the fact that in a year, annually, there are 10 million people that get sick with tuberculosis. Then you find out that out of those 10 million, 1 million are kids. So you see that it's widespread. It's not just an adult disease, it's a children disease too. And out of these 9 million, up to 3 million don't get treated. And at the end of the day, every year, it's estimated that almost 2 million people die from tuberculosis. Tuberculosis, statistically speaking, is the number 3 killer disease after HIV and malaria. And mind you, it's number 3 and number 1 killer disease that is curable. Why are people dying in millions for a disease that can be cured?
Okay. You have a project.
Yes, sir.
And I can see that boldly written on your dress.
Yes,
Do
sir.
not die. Tuberculosis is curable. Tell us more about that.
Okay, this was a project that stemmed from a deep burning desire. Like, I'm a core member in Akure, and I got to be rotated to the abattoir, and I found out that a lot of meat was being condemned for tuberculosis. Like when you see a tuberculin offal, we condemn it. And then I realized that a lot of people don't know that tuberculosis kills. A friend of mine had tuberculosis when she was 23 years old. That's a young girl. A senior colleague of mine died from tuberculosis in her final year. That was a really big loss to me. So I already had a lot of passion to advocate for tuberculosis. Please go get tested. Please go get treated if you're positive. So it stemmed from a deep-seated desire to just tell people to advocate for public health in respect to tuberculosis. So it's actually a documentary that we're filming, public health importance of tuberculosis. We're just trying to join hands with WHO because WHO has estimated a world eradication of tuberculosis come year 2035. So it's a let's join hands and do this together kind of a project, which is also in line with the SDG goals. So it's actually just about finding as much as possible people who are positive with tuberculosis, encouraging them to please go get tested, and encouraging them to get treated for tuberculosis.
That's quite elaborate. We have to get together in order to put hands on deck and ensure that we stamp tuberculosis out of existence if that is possible. And thank you very much for your explanation. Viewer, this is Health Matters, your TV health program on OSRC TV. We are here with our guest, Dr. Nonye Ukweni, and she's been telling us quite a lot about tuberculosis. When we come back, we will talk about the types, we will talk about the prevention, and we will also talk about the treatment. Don't go away. Welcome back. You are still watching Health Matters. My guest, Dr. Nonye Ukweni, is still very much around. We are talking about the public health significance of tuberculosis, issues, action, and resolution. And Doctor, once again, you are welcome.
Thank you.
We are talking about tuberculosis. I want you to open up on this. What are the various types or categories of this that we have?
Okay, we've already talked about the fact that it could be transmitted from person to person, and then we've talked about the fact that it could be transmitted from animal to person. Now, tuberculosis poses a very great risk in our society because if 10 people are standing, statistically speaking, it's postulated that at least 8 people have tuberculosis. So that's to say that there's a latent form of tuberculosis. When I say a latent form, I mean that someone can have tuberculosis and not know, and then the person goes about the person's normal life, not transmitting the tuberculin nodules either, because it's just latent, it's just in the person's body. And then there is an active form of tuberculosis which could be triggered off by immune depression. Maybe the person gets HIV and HIV kills the person's immune system, and then you realize that active form can be spread. It could be spread from one person to another. And then let's say that same person that was active starts treatment for tuberculosis, and then the tuberculin nodules reduce, the bacteria reduces, but the person is not totally cured. So the person stops treatment because the person is obviously feeling better, no more gross signs of tuberculosis. Then the person stops, and then the tuberculosis goes, just like as if it has gone, and then comes back like a roaring lion seeking for who to devour. So that being said, that shows that tuberculosis can be latent, it can be active, and it can be multiple drug resistant. When you say it's multiple drug resistance, it is actually as a result of the fact that you've used the antibiotics to treat it before, then you stopped. So the tuberculin microbacteria multiplied and got resistant to the drugs. So treating it now has to come in a very aggressive form. It has to be thoroughly treated. And earlier I talked about my friend that had tuberculosis at the age of 23. She had to treat tuberculosis for 2 years. So you see, it's a longer period of time to treat tuberculosis. So I think the symptoms of tuberculosis can be expressly divided into those 3: latent, active, and
Thank you.
drug resistance.
You scratched it on the surface, treatment.
Yes, sir.
Having taken the 3 types that we have, let us now consider the treatment. How can we find solution to this? How do you treat a patient that has come down with tuberculosis?
Okay. Tuberculosis is a very hardy disease because what tuberculosis does is that it goes into the system, forms a wall around itself. That's why it appears as lumps, nodules, in wherever it's situated, in the lungs, in the liver, in the kidney. So what happens is you actually have to treat it consistently for at least 3 months to 6 months. So you see, it's a very long time to treat this bacteria, to just try and kill it. So treatment of tuberculosis uses very specific antibiotics, which is going to be prescribed by a doctor. There is the rimpavin, there is the isothiazide. There are 4 basic antibiotics used in treating it. Now, treatment for tuberculosis is a 3 months to 6 months thing, but if it is a multiple drug resistant tuberculosis, it takes longer. I told you of a friend that treated for 2 years. So it's no joke, and it's something that we're trying to eradicate because it's curable. So let's try and kick it out of the society.
Okay. Treatment of tuberculosis takes much longer.
Yes, sir.
To avert that, what do we do? That's prevention. And prevention, they say, is better than cure. What do you suggest? How do we prevent tuberculosis?
Basic preventive measures for tuberculosis is just what we're doing right now, talking about it, enlightening people. Hey, there's tuberculosis. You could get it by just talking to someone. You could get it by relating with animals. So I think the first step is actually enlightening people that tuberculosis is out there. The next step is also encouraging people to please go get tested. You don't know what you're carrying till you actually ask, am I carrying it or not? So it's actually very healthy that you should know your status concerning tuberculosis. Do I have tuberculosis or not? If I have it, please let's start treating it now, so as to eradicate tuberculosis. If I don't have it, good and fine. You encourage other people to go and get tested. Vets in the abattoir is a very big plus. Kudos to my bosses and everybody, all the vets around. Please, screening meat is very important. Vets in the abattoirs, in any slaughter slab, wherever they are killing animals, vets should be available to vet this meat and ensure that meat that is going into the population is actually fit for consumption. So another step to eradicate it is vaccines. There are vaccines available for kids to confer immunity on them. Now, the state government has been really kind, and in line with WHO, treatment is free, absolutely free. All you have to do is go get tested. If you're positive, you get treated for free. And if you're a child between 0 to 14 years old and you're positive, X-ray is free for you. So diagnosis of adults is free. The only thing that you have to pay for is X-ray, but treatment is also free. These drugs are very expensive, but it's made available just so that we could try and eradicate tuberculosis. So I think more people need to talk about it. More people need to know that these things actually exist. More people need to go get tested, get as much people as possible to. I think it should become a movement. Oh, me and my family members just got tested for tuberculosis. I think it should be something that is worthwhile to know that, okay, good, we're making moves to actually eradicate tuberculosis because it's worthy of eradication.
Thank you. Now let's go to the public. You've been to the abattoir many times.
Yes, sir.
When you inspect an animal, what do you do when you realize that an animal has come down with tuberculosis?
First, there is antemortem inspection. Antemortem inspection gives you a gross view. That is when the animal is still alive, to know if this animal is actually fit for slaughter. Then there is a postmortem. That is when they've killed the animal. So when they've killed the animal and we realize that, oh, the carcass has tuberculosis, the ideal thing we do is to condemn it. You totally condemn offals or anything that is associated with tuberculosis, because it's no joke. It's something that the butchers understand it because we did an awareness program for them. the cattle traders, they understand it because we've tried as much as possible to sensitize them that this kills people, this can affect people. So we are actually there to safeguard the food or the meat that goes into the population.
Okay, by offals, you refer to the inside part of the animal,
Yes,
the lungs,
the
the
lungs,
kidney,
yes.
and those other parts. Now,
Yes, sir.
when you open up this animal and you realize that some of these parts have been infected,
Yes.
what exactly do you do with the meat, if I may use that word now, because they want to sell it?
You condemn it.
Okay.
Most of the
And
times,
what is their reaction to that?
it's not easy to say the truth, but they've been cooperating because they know that this is not good. It's not good to be sold, but we condemn it.
Okay. Now, for the animal that is yet to be slaughtered,
Yes.
that is yet to be slaughtered,
Yes, sir.
when you find out that that animal is down with tuberculosis, what do you do to that animal?
You see, tuberculosis really has not really been. It doesn't go to the muscles. So once you realize that, okay, this animal, in saner clients though, the tuberculin animal should be called. They should be slaughtered in saner clients. But I mean, you have to realize that sometimes these people don't get compensated. So what we do is we condemn the parts of the animal with nodules. If the lungs has nodules, they are condemned. If the liver has nodules, they are condemned. But we can't start condemning parts that don't have tuberculin nodules
Okay.
because they are still safe for consumption.
But assuming virtually it's established that the cow now, is maybe very lean. I've seen some animals
Yes,
like
sir.
that.
Yes, sir.
And you have concluded that this animal
Is
not good for
Yes, sir.
human
We
consumption.
condemn it.
You condemn it.
Yes, sir.
And how do you do that?
There was recently when I was at the abattoir last, we buried a full carcass.
You buried the
Yes, we
animal.
bury it. We pour quicklime on it and bury it.
And what is the reaction of the cow seller? Do they like that?
Nobody would like that, but they I think we've gotten to the point where they understand that this has to be done. It's them. They see the lesions. The lesions are when they are gory like that. When they are really bad, even the cartoon, the trader, the abattoir worker, he knows it's not fit to be sold, and especially when there's an authority there. So we are the authority. We're telling them this is not fit. So it's just like the policeman impounding your car. You don't like it, but you did the wrong thing.
But he has to do his job.
Sure, he has to do his job.
And thankfully they have been cooperating, you said.
Yes, sir.
Now, may we have your closing comments? Give us elaborately your advice to the public.
Okay. So first, I want to tell this to all my listeners out there. If you have tuberculosis is a journey that someone having tuberculosis doesn't necessarily mean they are bad people. It doesn't necessarily mean that they took a wrong step when others were taking the right step. It just means that they need our love, they need our support. They need us to go out there and tell them, oh, this has happened, it's just a matter of time. Good health, a clean health bill is better than money. If you can start treatment and go for your treatment, we're supporting you. It's not a time to start stigmatizing people. Yes, encourage them not to cough and spit around so that they won't actually propagate this tuberculosis spread, and also encourage them to carry other people that are staying with them to go and get treated and tested. Encourage them during their journey for treatment because they are doing the right thing. Encourage them to finish taking their medication. Also, I want to thank the OSRC for the opportunity to at least tell more people about this. Is a passion I've always had to be a public health advocate, and I'm really grateful. I'm also grateful to my bosses. I don't know how many people can.
All right. Thank you.
say
Thank
that.
you very much. Thank
Yes,
you
sir.
very much. So what we have there is do not die. Tuberculosis
It's
is
curable.
and that's what she's telling you.
Yes.
So if anyone has come down with tuberculosis, that person should find his or her way to the hospital. And Dr. Nonye
Yes, sir.
Ukwini,
Yes, sir.
thank you very much for being with us on this show. I hope when next we find cause to bring you here, you will certainly heed our invite.
Thank you.
And viewer, thank you very much. For some time you've been watching us My guest, an enemy of tuberculosis, has been doing much talking. She told us that if you have any feeling that could suggest that you have tuberculosis, feel free to go to the hospital. Their medication is free, and try as much as possible to ensure that you do not stigmatize anyone who has come down with tuberculosis. This is how far we can go on today's edition of Health Matters, your TV health program. Yomi Ogunye is my name. Do find time to join us again same time next week. Thank you very much for watching us, and goodbye.